So, Dr. Jaffe, this is about a patient writes in here. So he says, I have early stage kidney disease, and I'm concerned about the potassium that I'm taking in when I have to do the C-Cleanse, since Potency Guard has potassium in it. So I'm supposed to be limiting my potassium. So can you address how I can, deal with this issue, and should he avoid the cleanse because of this?
Well, that's a very important question, and you bring me back to my early days in medicine half a century ago. In the 1960s and into the 1970s, the important role of hydration in regard to kidney health was underappreciated. And in addition to hydration, the essential depletion of magnesium leading to cell acid excess, leading folks paradoxically, I'll explain the paradox in a minute, to recommend restricting potassium. Then we recognized how important hydration was, and then for 20 years we recommended potassium. Potassium chloride, potassium in a variety of forms. And what we learned again was that potassium is a support mineral. It is not a primary essential mineral. So when someone is well hydrated, say they take in broths, they take in water with a squeeze of lime juice, they take in a variety of wet and warm foods. When they correct their hydration, their kidney function improves. And when I say kidney function, I don't just mean creatinine and BUN, I mean the eGFR, the estimated glomerular filtration rate. The eGFR is probably the most important measurement that's easy to do and that most physicians and people concerned about kidney health correctly use. So I've seen eGFRs go from 30 to 60 just by correcting with good hydration and a mineral rich. And when I say mineral rich, I mean lots of minerals, including potassium and magnesium, but also lots of trace minerals to replete, to replenish the essential parts of the kidney. It's called the loop of Henle for the doctor who first identified it, that depend upon having enough magnesium in the cell, more important even than potassium. Having enough manganese and molybdenum, having enough zinc and copper, having enough of all of the, quote, trace minerals that you find in quality sea salt, like Maldon, that's a brand, or Celtic sea salt, my favorite. But the traditional Celtic sea salt, that's 13% trace minerals, which is much, much more than almost all of the other so-called sea salts. We won't get into the details of how to make sea salt because you probably won't do it at home, but it does make a difference to have enough of the good and not too much of the harmful. So with regard to early kidney issues, I assume that this means the eGFR is in the range of 30 to 60, probably in the 40s. And I have seen it reverse and improve from that up into the 60s, which is quite okay. If you have only one, most people have two kidneys. But if for one reason or another you lose one kidney, you can still have a perfectly normal life with an eGFR of about 60. So we know what non-invasive measurement to use. We know that most people are just 1, 2, or 3% dehydrated, and that stresses every part of them from their heart and their lungs to their kidneys and their liver. And you can correct that in the ways that we have recommended, nature's alkaline way, eating wet and warm. Then you can be good to your kidneys. You can help wash toxins out of your kidneys by doing a C-Cleanse, which includes potassium and calcium and magnesium and zinc in balance. Notice I said in balance. Because in addition to your kidneys, you have something called your skin, which is actually a backup system for the kidneys. And then you have the intestines. And so your intestines, your skin, and your kidneys work together to balance out your minerals. So I understand that people who don't understand often inappropriately overlook the dehydration and the other, quote, risk factors, correctable and easily reversed with lifestyle habit change. But I suggest that whoever is interested in current cardiorenal health, because kidneys and hearts and blood vessels all intimately go together. Look at the work of Sam Mann or Peter Feig. Look at the work of George Bacris or Michael Weber. Look at the work of Harry Gavris and Ron Elleen. Look at the work of Mildred Seelig and Andrea Rosenoff and Rebecca Costello and Patricia Doister, all of whom I'm more than honored to have as my colleagues and more than friends. And they have been teaching us for decades that too many people are informed that they have kidney risks without being informed that they have kidney opportunities. And we want to inform, inspire, make accessible to people these evoking of healing responses to reverse early kidney dysfunctions, which is the rule, not the exception. But knowing what the right thing is and doing the right thing are two separate matters. So yes, put us to the test. Yes, measure your EGFR, and you might want to measure that every couple of months. It's a non-invasive urine test. And yes, I am highly confident that most of us can reverse, restore, rehabilitate our kidney function by looking at the causes, not at the consequences. And when you avoid potassium, you're misunderstanding an opportunity, and you're not correctly understanding nature's messaging in regard to how your kidneys, skin, and intestines function together. So all of you is related to the rest of you, and may it all be well and happier, functionally happier, by taking advantage of a contemporary 21st century understanding of the role of potassium and magnesium, the role of hydration, and other related metabolic functions that in turn determine what your kidney health is.